Hi and welcome to this week's Oxwide. We've another packed edition for you and coming up in today's programme. We had a special visit earlier in the week from the Kenyan High Commissioner and from the Kenyan government. Find out why they came to see us. Give yourself a double boost. We speak to Kerri Rivers-Simpson about the opportunity to get jabbed this month for both flu and COVID. We meet our newest rising stars, Jesca and John, and talk to them about receiving their Royal College of Nursing awards last week. That's the films we'll have, but first, a special update from our Interim Chief Executive, Ify Okocha, who is, like many of us here, celebrating Black History Month. Over to you, Ify.
Hello everyone. October is Black History Month, a real opportunity for us to reflect on the work of our Building a Fairer Oxley's movement and recognize the work of our BMEX staff network. But first, I must say huge congratulations to Jesca Gudza and John Owiti, our two inspirational nurses who were announced as Rising Stars of 2021 by the Royal College of Nursing. Well done to Jesca and John. We're all extremely proud of you. Our BMEX staff network will be hosting a very special Black History Month event on Monday, 18 October 2021, alongside their annual members meeting. And I'd like to personally invite you to join us, not only to talk through our achievements, but also to take time to remember lost loved ones and colleagues. We're also extremely pleased that our special guest, historian Paul Obinna, will join us at our event on the 18th to share his fantastic cultural capital timeline, which explores the vast spectrum of Black history. Lastly, please don't forget to join our Mental Health Staff Network later today when they celebrate World Mental Health Day from 2 p.m. with special guests on MS Teams. We'd love you to join us to help mark this special occasion.
Thanks again, Ify, and we love the new look. On to our first film. We met the Kenyan High Commissioner and government on Monday to talk about our special relationship. Let's see how it went.
So the global health movement within our trust actually is more or less a year old, but then the activities had been much hampered by the pandemic. So we have had a couple of activities throughout the year. We had a conference sometimes earlier in the year, and the Global Health Partnership actually also brings in University of Greenwich. We have university partners in Kenya, University of Nairobi, which actually over the last couple of months we have also been approached by some other universities in West Kenya. So actually our movement is actually expanding very fast. So this visit is actually a very, very important visit for us. I'm delighted that the Kenyan government has actually chosen Oxley's to be one of the partners in terms of executing this bilateral agreement.
And this is really exciting because we are mutually learning together, sharing innovations, looking at developing clinical care, both in Kenya and in Oxley's, but predominantly supporting our Kenyan colleagues. Working globally has so many benefits. It adds social value across the world, and it means that we can think outside the box, we can contribute to improving equalities in Kenya, where there are some real disparities and some real health challenges, which is why the UK and the Kenyan government have signed an agreement to work on this together over the next few years. I just think there's really great opportunities for patient outcomes in both countries. We have lots of nurses from Kenya, and we have links across the organisation, across London. Many of them are working together, and we really want to support the Kenyan government with this initiative.
This is a very exciting opportunity for us to foster mutual, I could say in simple words, mutual benefits between Kenya and UK, where we are making special contributions to global challenges. And I'm really keen to work with Oxleys to reach communities which are marginalized, which have no access to mental health care. And this is, for me, a very exciting opportunity.
We actually have about 40,000 nurses that you would say is available workforce that we've also tapped into, especially during the COVID pandemic. Beyond that, every year as a country we graduate at least 7,000 nurses, and we can only absorb so much of that. So we do have sufficient numbers of health workforce, particularly nurses. And I think the important thing to also say is that the kind of training that we offer in Kenya is very robust. Our nurses are exposed to 3 fundamental areas, as I've come to understand in nursing. One, they're very exposed on mental health during their training, both in terms of the academic learning and practical clinical experience. They are also exposed to community work, and they are also exposed on midwifery. So a nurse from Kenya is already well-rounded to offer service in any sort of clinical area within the scope that I have just talked about. So that is, we have a rich resource in terms of workforce that is available to serve our people and also to extend to our friendly partners and friends such as the UK. And I think the timing couldn't be better because in our discussions with the NHS, we met the head of nursing, Ruth May, and the one thing that came very clearly across from them is that there's a strong call from some of the trusts to have more diversity in the recruitment base. And Kenya is amongst the 8 countries that they have identified as part of where they want to begin targeting to recruit from. So we feel very delighted and very excited about that opportunity. I think the partnership with Oxwide means a lot for us as a country, and particularly because of the focus that we are having on mental health. That we believe we could benefit from the experience that Oxalis and her network of partners has in terms of, just the operational strategies around running mental health care, and also just experience about the various and modern therapies that we need to begin to incorporate in our clinical services. So there is so much potential for us here, and great opportunities that speak right to the priority of the Kenyan citizens. And I also believe that it is also presents a good opportunity for some of your staff to also come for observerships and just be on a ground tour in Kenya and just perhaps learn from what we also do, because everybody has something to learn from the other. And so we really look forward to a very rich and long-term and sustainable engagement to further the issues of mental health. Thank you.
That was such an enjoyable visit. Next, we caught up with Kerri Rivers-Simpson to find out about this year's flu jab and COVID booster. Let's see what she had to say.
Our flu vaccines have now arrived. They have all been distributed around the trust into all of the inpatient wards and other clinical areas. So they're available now. All of the flu clinics are on the Ox, so if you go to the flu page on the Ox, there's a calendar, so you'll be able to see if there's a clinic that's convenient for you. Most of the clinics are drop-ins. If they are not drop-in and you need to book, it will state that they will, but we're happy to see anybody that wants to come along. We can only give flu vaccines at the flu clinics because we can't roam with the COVID booster. But if you want to have your flu vaccine and your COVID booster at the same time, you can have them at the COVID clinic at Queen Mary's, and you can book on the link below for there. The Easy Check sheet will let you know whether you are eligible to have your COVID booster, and if you are, then you can easily book that via the PathX system. Anybody within Oxley's can get a COVID booster as long as you're 6 months post your last jab. It's not just for over 50s, it's for everybody. So make sure that you check the dates on the PathX system. You need to have an appointment, so please just don't turn up at the clinic. Make sure you've got your appointment and you've checked your dates. Please make sure that you've had both of your jabs, your first and your second COVID jab, before you book in for your COVID booster. You must have had both of your initial jabs and then 6 months before you have your booster. Please make sure you protect yourselves this winter by ensuring that you have both of your COVID jabs, your COVID booster and your flu vaccine. It's the best way that we can protect ourselves, our families, but most importantly our patients.
Thanks to Kerri for the great advice and for taking time out of her busy vaccine clinic to talk to us. For our final film today, as Ify mentioned in his piece earlier, we've 2 inspirational nurses, Jesca and John, who've both been announced as rising stars by the Royal College of Nursing. Let's find out what they had to say.
The Royal College of Nursing Rising Star Award is given annually to a group of nurses who are nominated across London. They could be nominated by colleagues or managers or peers or anybody. There is a huge number of entries. This year has had a real focus on fairness, and the nominations that I put forward were for people who really demonstrated they'd gone the extra mile. I think it must have been really tough for the judges at the Royal College of Nursing, but I'm absolutely thrilled that we have got 2 rising stars recognised, and they are both absolutely incredible. Jesca is a looked after children's nurse, and as well as doing lots of work, really brilliant work in her role within Oxley's, she's made some very personal contributions to our building fair at Oxley's over the last year. But in her spare time, she's also the founder and chairperson of Zimna, which is an organisation that supports new nurses coming over to England from Zimbabwe, and she set up a network across the whole country to look after their welfare and support them. It's an amazing organisation, and again, I'm really proud of the fact that she's done this.
So when I saw my email about being recognised as a rising star, I was like, oh, this RSC, and they invited me to these things again. So I opened the email, shut it down again, and then I thought, it's saying something. Congratulations. Okay, let me read it again. And I was like, I don't understand it. And then I went running upstairs to my daughter. I said, hey, can you see what's happened? I've been nominated and I've won. I was really excited. And I just really want to thank Jane for honestly nominating me and recognizing the work we do as looked after nurses in Bexley, and you know how diverse it is, because we look after children from diverse families, and especially those that are coming into the country from being asylum seekers. And for me, that those young people, as I came into the UK, I turned 19 in the UK, so I was fairly young, and I could totally understand the journey coming in and not knowing where you are and learning new things. So it was really important for that recognition to come, and it makes a lot of it's given me a lot of joy, and for me it's satisfaction for the job I do. It's also recognizing that looked after nurses out there do a good job, and having worked in Oxley's for 12 years, and to be nominated for this award, I am so proud and pleased.
John is incredible. He's really championed our global partnership working with Kenya. He's put a lot of his own time into this. He's put a lot of energy, and he's really focused on building relationships, which is the platform of everything that we're going to be doing.
I am excited, delighted, and this is really an Oscar moment for me, that actually this achievement has been bestowed upon me. It means a lot. And actually, it gives me the energy to be able to move on with the work that we are actually currently doing within Oxley's. It was a surprise. Yeah, it was a great surprise. I got an email about 3 or 4 weeks ago informing me that I had been awarded the Rising Star Award. but then I had to keep it secret. For a whole month, I've been having a lot of mixed emotions about the award itself and what it means to me in my career, what it means to my colleagues that works with me as well, but also what it means to the nursing profession, but also what it means to Oxleys as well. I hope many colleagues that work with me within Oxleys, but also that work within the nursing profession, would actually would be energized that actually anything is possible. Anything is possible.
Well done again, Jesca and John. You really deserved that award. So that's all we have time for this week. Thanks so much to everyone who spoke to us, and we hope you enjoyed our films. And don't forget to nominate someone for a recognition award by visiting the Ox and completing a short form. Please take a look at our flu page on the Ox for details of where you can get your jab, and of course, keep an eye on the famous jabometer. Please remember, if you and your team would like to feature in future Oxwides, drop us a line at the email address on the screen now and we'll get in touch with you. So until next time, goodbye.